But when we think about recovery of the arm, it's not just about all the one thing. It's about all these things. It's about can you manipulate things? Do you have dexterity? How does it affect your activities of daily living? And that means that you might achieve something with compensation. You might be able to dress yourself. You might be able to do things with compensation. Spasticity is another thing that we look at that interferes with people's recovery. Range of motion, obviously something that's important for people. Do they have the sensory function, the proprioception and sensory function? And so as we get away and we look more broadly at recovery, there's many things we have to think about. It's not just about the one thing of motor recovery. And then of course, we want to look at muscle strength and other things. Whether the person could abduct their shoulder abduction, or if they could extend their fingers, they could categorize people into a good prognosis or a poor prognosis. So if you did not have shoulder abduction or finger extension at week 1, you were classified as a poor prognosis. And of the group who had a poor prognosis, some had a partial recovery and some and most had a poor recovery. A couple of points of emphasis. First of all, you have to, as Dr. Zeiler said, usually you have to pair these things with exercise. And I think that this trial as well did that. And again, we have not tried the rat model that he's talked about, where you don't give any exercise in humans, because most humans get some exercise of some sort. But in these trials, they all got exercise and they all got some rehab. And this is a point that is interesting to note, that in the initial trial, the CARS 1, there were 2 different populations recruited. This one had an RAT score that was less than 33, 84% of them. And in this study, the group was less disabled. And similarly, you see that there's differences in the disability of these groups. And one trial was more strongly positive than the other. And this comes back to that signal of maybe we should be using this in the group that's more severe, in that group that initially had a bad prognosis, and maybe that's the group for whom we should be targeting. That idea that if we could early prognosticate, we might be able to do what we call precision medicine in this area. And you can see that cerebral lysin does make a benefit for those 3 domains. And this is why it appears in a number of the guidelines, as you heard. We were very interested in trying to pool that evidence for clinicians as best we could. So this is a tool called Via Therapy. You can download it from the internet. It's an app, it's free. But the important thing to remember is that we do have clinical models and emerging models for prognostication that will help us to understand which treatment applies to which patient. When we, as the others have said, when we combine those pharmacological treatments with the enriched environment, we are most likely to enhance neuroplasticity. And finally, because there are hundreds of clinical trials and it's hard to navigate that evidence, it's really important for you to use the resources that are available